our borders for 2 more weeks until further notice. The data tells us that the overwhelming majority of confirmed cases came from travelers and from people who have come into contact with travelers. Fellow Ghanaians, tonight I stand before you to ask for your continued patience, support, vigilance, and adherence to the measures. Let each one of us play his or her part to enhance our collective efforts at containing the spread of the virus, which will enable us to hasten the lifting of these restrictions and returning the nation to normalcy. I was encouraged by the appreciation of government's handling of the pandemic and the offer of support by the leadership of the major political parties in the country when I met with them on Friday. I applaud Parliament's decision to call off its planned recess and be on standby to aid in the fight against the virus. I thank staff of the University of Ghana's Noguchi Memorial Institute for Medical Research, the Kwame Nkrumah University of Science and Technology's Kumasi Center for Collaborative Research, and the National Public Health Reference Laboratory of the Kolebu Teaching Hospital for the solid work they are doing for Mother Ghana. I'm very grateful to the individuals and institutions who have responded to my appeal for donations to be made into the Covid-19 National Trust Fund, which has been established to complement government's fight against the virus and to assist in the welfare of the needy and the vulnerable. A total amount of some 8,750,000 cedi, which includes 600,000 United States dollars, have been received so far for this purpose. I'm happy that so many appointees of my government have also followed my example by donating their salaries to the fund. We are in difficult times. And that is why I directed the Minister for Finance to send to Parliament the Coronavirus Alleviation Program, whose objective is to protect households and livelihoods, support micro, small, and medium-sized businesses, minimize job losses, and source additional funding for promotion of industries to shore up and expand industrial output for domestic consumption and exports. Through this program, the Ministries of Gender, Children and Social Protection and Local Government and Rural Development and the National Disaster Management Organization, NADMO, working with MNDCEs and the faith-based organizations, have begun to provide food for up to 400,000 individuals and homes in the affected areas of the restrictions. This began in Accra today and will begin in Kumasi tomorrow. It will come in the form of dry food packages and hot meals, and will be delivered to vulnerable communities in Accra, Tema, Kumasi, and Kasua. Again, the Ghana Water Company Limited and the Electricity Company of Ghana have been directed to ensure the stable supply of water and electricity during this period. In addition, there will be no disconnection of supply. Furthermore, government will absorb the water bills for all Ghanaians for the next 3 months, i.e. April, May, and June.
Okay.
All water tankers, publicly and privately owned, are also going to be mobilized to ensure the supply of water to all vulnerable communities. Government, in collaboration with the National Board for Small-Scale Industries, business and trade associations, and selected commercial and rural banks, will roll out a soft loan scheme up to a total of 600 million cedi, which will have a 1-year moratorium and 2-year repayment period for micro, small, and medium-scale businesses. Fellow Ghanaians, it is vital that we protect the lives of our frontline health workers who are risking their lives every day to battle this virus. That is why government is placing a high priority on the procurement of personal protective equipment for them. Thus far, 350,000 masks, 558,650 examination gloves, 1,000 reusable goggles, 20,000 coveralls, 7,000 N95 respirators, 500 waterproof gumboots, 2,000 reusable face shields, 2,000 gallons of hand sanitizers, 10,100 milliliter pieces of hand sanitizers, and 500 shoe covers have been sent to the regional health directorates for onward distribution to the district health directorates for use by our health workers in all the districts. Then the Minister for Health is ensuring that they reach the health workers. This notwithstanding, government is aware that more needs to be done, especially in the face of the global shortage of PPEs. It is for this reason the government is actively engaged with local manufacturing companies to assist in the domestic production of PPEs, and I'm encouraged by the response from the Ghanaian private sector. Domestic production of face masks, head covers, surgical scrubs, and gowns will commence from Tuesday. For example, 3,600,000 face masks will be produced domestically with an output of 150,000 per day. I'm equally impressed with the invention of a solar-powered hand-washing sink by Judose from Kumasi, and the Covid-19 prevention electronic bucket made by Kelvin Owusu-Dapa and Richard Boate, both students of Obuasi Senior High and Technical School. Necessity indeed is the mother of invention, as the Ghanaian sense of enterprise and innovation is beginning to be felt. An insurance package with an insurance sum of 350,000 cedis for each health personnel and allied professional at the forefront of the fight has been put in place, with a daily allowance of 150 cedis being paid to contact tracers. Government has also decided that all health workers will not pay taxes on their emoluments for the next 3 months, i.e. April, May, and June. Furthermore, all frontline health workers will receive an additional allowance of 50% of their basic salary per month, i.e. for March, April, May, and June. The March allowance will be paid alongside that of April. The Ministry of Transport is also making available for free Ayalolo buses to convey health workers in Accra, Tema, Kumasi, and Kansua to and from work along specific routes for the entire duration of the restrictions. I'm happy that operators of public transport, such as trotros and taxis, are largely adhering to the admonition to observe social distancing in their vehicles. Each one of them should do so. Towards ensuring the cleanliness of our country, especially in the Greater Accra and the Greater Kumasi areas, which are currently the subjects of the restrictions, the Ministry of Sanitation and Water Resources, together with some 400 personnel drawn from the police, military, fire service, and prison service, from Friday 3rd April to today, Sunday 5th April, have embarked on desalting our gutters, collection and disposal of garbage from homes, public places, markets, and vehicle terminals. We must ensure that the end of this exercise will lead to a new attitude towards cleanliness in our surroundings. That would be a positive legacy from this crisis. MMDAs outside the areas affected by the restrictions have been directed to emulate this cleanup exercise.